Hi everybody, this is our last topic in Unit 1. So topic 1.5, documentation and communication in the age of e-health technology. This is an area in healthcare that's going to continue to evolve as new technologies are brought on board. The only thing really holding back the use of technology in healthcare is dollars. It's very, very expensive to bring in new technology continually because things in technology change so fast. But healthcare does not have that kind of money to be able to change with those. So they are gradually introduced. So we're going to talk about electronic health records, also known as electronic medical records. So depending where you live or work, you're going to see EHR or EMR, but they are the same thing. So they're electronically stored information about an individual's lifetime health status in healthcare. Very complex interconnected set of software. Some include pharmacies, physiotherapies. Ideally, all the healthcare information would be connected regardless of where they sought their healthcare from. Processes and transport data. The data guides teams to provide care while also identifying needs. It allows each member of the healthcare team that's treating this client to have access to everything. And you can also retrieve past records. Contains very similar data to the charts that we still see in some hospitals. You have medical history, clinical status, labs and diagnostic results, treatments, client care interactions, tick sheets, EMT sheets. All that stuff will still be there. Advantages of the electronic health records. Well, electronic health record recording usually speeds up the time required to document and improves accuracy and legibility. This advantage is debatable if the care provider does not know how to use the electronic system correctly. And I mean, that's training, right? Training will correct that. Electronic systems reduce reliance on a care provider's memory, as client information can often be completed in real time. Sometimes electronic documentation is done at a specific computer station or at a central location right after the care has been completed. There's a lot of the hospitals now that are now having computers in the actual patient's room, and so that whoever is doing patient care at that time can easily record it. Computerized systems permit healthcare providers who care for a specific client to enter updated data so that everybody has access to the same information. It also assists in standardizing data and care. Disadvantage, oops, I missed a disadvantage. Disadvantage, though, very expensive to implement, maintain, and as I already alluded to, technology is changing so quickly, but healthcare doesn't have the dollars to keep up to date in a lot of this stuff. Requires staff training and keyboarding skills, often requires retraining, less team interaction and collaboration, risk of loss of access to client data if our computer systems go down. Maintaining security of systems is always an issue. Need for constant upgrades and maintenance. I mean, everybody who uses a computer realizes how often they have to be upgraded. And there are hackers. Hackers who may violate client confidentiality and can actually disrupt huge systems. These are constant thing that need to be watched for. But there are ethical, regulatory, professional issues as well to using electronic methods of reporting client care. Ethical duty to ensure clients are well informed and voluntary. So they don't get the option to agree to do it. I mean, that's the way charting is going to go, but they have to be informed about what's happening. Confidentiality and autonomy, the right to control the circulation of information about oneself. They can actually decide where their information goes. Informed consent. Does the client understand how the information is dispersed? So just like having a surgical procedure, they need to we need to have consent to use our information. Increased ease of access to and transferability of health information means it more difficult to ensure confidentiality. It's so true. Legal issues. The Supreme Court of Canada has held that clients have a right to confidentiality of their medical records. So we need to protect the private information within public service. And it is not going to change anytime soon. There's always going to be privacy issues. Provincial legislation. So Alberta's Health Information Act establishes rules for the management, the sharing, and the exchange of personal health information. FIFA. A client must consent to have their information entered into electronic records. Once consent is obtained, it continues on without further consent. Types of technology, and this goes on and on. So databases on computers and laptops, Palm Pilots, cellular devices, iPads, tablets, video conferencing, proxies. So you're going to see cellular devices more and more used. I think it's only a matter of time before healthcare providers all carry a cell phone, whether it be a cell phone that's come from the institution or their own. There's going to have to be some way of preventing the leak of information. But I mean, we use technology now for so many things. You know, you can check your drug doses to make sure they're the appropriate drug dose. You can look up diseases, what you should be doing. We use technology a lot now. It's only a matter of time before I think it ekes even more into healthcare. Advantages: ease of use, faster documentation. As I've said, programs which give you prompts to make your documentation better. It means you can't forget anything. Because it's easier, people may be more likely to document in a timely manner. The new generations coming up are more adept to using technology, so they will embrace this more than the older population who's using it currently. Disadvantages: client may be reluctant to provide information if they know it will become electronic. My father-in-law would be one of those. He thinks the computer is a devil. Someone may see your screen. Someone else may access your profile if you don't log out. And your password is your signature. If you make it too simple, easier to be hacked. So strategies to enhance electronic documentation. Remember to save all your entries. And I've had to learn that the hard way. Be familiar with policies and attend education sessions. Log out if leaving a device. You must log out. Ensure privacy when documenting. No one over the shoulder. Make your passwords secure. Include capital letters. Include numbers. Include characters if allowed. Avoid common types, birthdays, pets' names. Do not share your password with anyone. Just like you protect your password that you use on your private computer, you will protect your password that you use on electronic computers in the hospital. And that is the end of Unit 1. So we'll be on to Unit 2 shortly. I hope it's all going well.